Lassa fever is a very dangerous disease. In areas of Africa where the disease is endemic, Lassa fever is a significant cause of morbidity and mortality. Humans usually become infected with Lassa virus from exposure to urine or feces of infected mastomys rats, which is the carrier of the virus. Lassa virus may also be spread between humans through direct contact with the blood, urine, feces or other bodily secretions of a person infected with Lassa fever. Person-to-person transmission occurs in both community and healthcare settings where the virus may be spread by contaminated medical equipment such as reused needles. There have also been reports that support sexual transmission of Lassa virus. Prevention of Lassa fever relies on promoting good personal and community hygiene. Also, family members of a sick person should always be careful to avoid contact with blood and body fluids while caring for the sick. Well, it's another edition of NCDC Situation Room on the network service of Radio Nigeria. I'm glad you could join us. My name is Abdul Fattah Otori. Welcome.
Wetin be this Lassa fever wey dey hear up and down so?
This na disease wey Lassa fever virus dey cause. E dey happen when person touch another person or rat wey carry this virus poo-poo, wee-wee, spit or even blood, and e no dey send age o.
Abeg, how fit take know person wey carry Lassa fever sef?
The sign dey show 2 to 21 days after person touch another person or rat wey carry this virus. Dem fit dey catch cold or weak or get body pain or sore throat or dey vomit plus purge or cough or make their body no dey fit stay one place or make faces swell up or make blood dey comot from any part of the body. Person wey get Lassa fever fit be like say na any other disease.
How we fit take stop this Lassa fever?
No near rat, dead or alive. Keep your house plus area clean. Store water plus food where rat no go reach am. No spread food for road or even open place. Dey careful with person wey get Lassa fever or the one wey Lassa fever kill. Make sure say you follow wetin government talk before you bury am.
Dem fit treat this Lassa fever?
E better make you treat am early immediately you notice am. So no waste time o. Go the hospital wey dey near you immediately you begin get the sign.
This message na with Federal Ministry of Health, the Nigerian Center for Disease Control, World Bank Ready Say Project, and UNICEF.
Thank you very much for joining us again on NCDC Situation Room today. Now, the last two editions of the program focused on Nigeria's preparedness to combat infectious diseases, and we had the CEO, Nigeria Center for Disease Control, Dr. Chikwe Ihekwazu, as our guest. He told us how prepared the center is to detect and respond to outbreaks of infectious diseases. A look at the situation dashboard of the NCDC shows a new cluster of suspected cases of yellow fever reported in Edo State on November 22, 2018. Since September 9, 2018, a total of 36 suspected cases, 2 presumptive positives, including 8 deaths, have been recorded. A national rapid response team has been deployed to Edo State and is working with the Edo State Ministry of Health and the World Health Organization and other partners. A planned yellow fever preventive mass vaccination campaign targeting over 20,000 persons in 6 states of Borno, Kebbi, Niger, Plateau, Sokoto and the FCT commenced on 22nd November 2018. As we've been mentioning on the program, dry season is the epic time for Lassa outbreak. So here's what the situation report of Lassa is like. Let's get to know more in the Situation Room where Godwin Odemije is waiting. Godwin, what's the update for this week?
Okay, thank you, Abdul. Now, I have on the line the head of Risk Communication Pillars, Dr. Ayola Olufemi. Hello and welcome.
Yeah, thank you very much and good evening.
Dr. Ayola, tell us the latest on Lassa fever.
Yes, in the reporting week 47, 6 new confirmed cases were reported in 2 states, Edo and Ondo State. 3 cases in each state. In Ondo, 1 health worker was affected, a nurse, and no new deaths. Patients are currently being managed at the Rural Specialty Teaching Hospital and Federal Medical Center, OWO. Lassa fever National Multi-Partner and Multi-Agency Technical Working Group continues to coordinate response activities at all levels.
What is being done to prevent the spread of the disease or create awareness on Lassa fever in the affected community?
Okay, thank you. We are working with the state affected to enhance surveillance, risk communication activities, especially community engagement and distribution of IC material is ongoing. We supply medical consumables to affected states. We are also working with Ministry of Agric and Environment to improve environmental sanitation and animal surveillance.
Are you saying NCDC officials are on ground to create necessary awareness on the affected community?
Yes, we have rapid response teams in the affected state, carrying out risk communication activities, engaging with the community to look at the behaviors that are promoting Lassa fever spread in the community and provide solutions to them.
Thank you, Dr. Ayola Olufemi, for talking with us in the Situation Room.
My pleasure.
Back to you, Abdul, for the rest of the program.
Thank you very much, Godwin. Indeed, very informative. Please continue to keep proper hygiene. Wash your hands each time you come into your house, especially before touching food or drinking water. Also, keep your environment very clean. It's very important. Now, let's pause for a while here to allow for messages from the drama group. Stay right here with us.
Usman, this coconut that you brought is very sweet.
I just stating the obvious. Look, have you ever eaten any bitter coconut before? They are always sweet, man.
Yeah, I know. Mama, my statement is just an appreciation of your good gesture of bringing me coconut. There is nothing special about it, so don't...
You see,
I am not saying anything. I know what you want to say. You want to remind me that I said I was not going to eat anything from your house again. Yes, and I still stand by it.
Okay, so why did you chop my coconut?
Give me. Let me tell you, coconut is well secured in and out. Okay. The first layer you can cut off with your machete. Yeah. But the second one, only cocobi. And it can only be broken by a hard material. So no matter how long rats, no matter how long they play on it, they cannot infect it.
You mean it?
That is the only reason I accepted this from you. Otherwise,
do you mean what you just said now?
Yes, now. Me, I don't play near rats at all.
One number every name is Oro. Because of small rat you saw in my house, my friends of many years, you, Adisa, is now running away from me. Somebody Allah. Heaven forbid I am infected. Yeah? They will quarantine me and my family.
Did I hear you say small rat? Yes, it is small, but deadly. Let me tell you, in Ekpoma, you know Ekpoma?
Yeah.
It killed 4 members of the same family. And one man in Abakaliki, Nile Ibo. Nurse, doctor, even relatives of the patients were all sent to their early graves by the activities of these things you call small.
Okay, I just stop it. Look, you are making me feel like embracing a black cobra while I take to my heels to the side of the shadow of a small rat. Okay, please, I'm going home.
Go. But make sure you keep rats completely out of your house. You hear me? Otherwise, me, I will not set foot in your house again. No.
Yeah,
okay.
Okay, Dr. Chuku, look, I'm not finding the threat posed by rats to this great community of ours, Ponipa. How can a small rat sack me and my family out of our house, my inherited house? Saboda Allah, gidan da babana ya bani kuma kakan kakana shi ya zauna a gurin fa.
Well, actually, it might look small, but the catastrophic effects are monumental in size and shape. Gamunte, listen. Have you forgotten ordinary rat sacked our Oga out of his office the right time? It is that serious, so. It is that serious, Ejoku. Lassa fever is caused by rodents, rats as you like to call it.
Okay, come. What is that name of that rat? So that even me, I'll start to watching out for it.
Well, before I tell you the name of the rat, let me let you know that Lassa fever is a zoonotic disease. What that means is humans become infected from contact with infected animals. In other words, the animal reservoir or host of Lassa virus is a rodent of the genus Mastomys, commonly called multi-mammoth rats.
What? That's my problem with you. Now you have confusing. Milk multi. I hear meat, I hear rat. Does this thing have any cure?
Well, let us not talk about cure for now. You see, prevention is far better than cure in all ramifications.
Okay.
Thank God, here is Chief Adisa. Welcome, Chief.
Dokita Chuku. Kushe. Adafun. Usman. This one that your face is Korelowo. You are looking very frantic. Are you here for consultation or?
Allah Adisa Ruanka. How does that affect you?
Will affect me. I'm only just concerned about the interest of the community. Because like they say, when one finger touches oil, it spreads to others.
How will you just mumble talk like that without tell me the meaning of what you just talked? Because I know you are insinuating something.
Doctor, if you open my mouth, it's only my tongue and teeth you will see. Look at it. I am just saying that Lassa virus can be easily transmitted from one person to another person.
That is very true. Honestly, Oyezioku. In the case of Lassa virus, every one of us must take it as a responsibility to ensure that we do not expose our foodstuff to infected rodents. Yes, I actually have a message for people of this community.
You do?
You see, as I was coming from my journey, I saw Gary, corn, and other grains spread on road pavements, and it was left overnight, as I was told.
That is how we.
No. That is an open invitation to rats, and consequently to Lassa fever.
Yeah, Mugbe. You see, doctor, that is what I'm saying. Those must be Usman people. They are the ones who behave like that.
What kind of talk is that?
No. I saw this one they use for making amala in the same place too.
Doctor, are you saying I won't eat amala again?
You want
Chere, please hold on. Let me tell us. It's not too difficult to prevent Lassa fever. We all need to learn to observe simple hygiene. That is it.
Doctor.
Thank you very much for staying with us. The program is NCDC Situation Room, and today we're looking at strategies in place to combat outbreaks of Lassa fever. Well, we always tell you not to leave the talking to us alone. You too can be a part of the discussion. Talk with us through Twitter. The handle is @NCDCGov. On Facebook, you can find us using Nigeria CDC. You can also reach us through a toll-free line. That means you don't get to pay when you call 0800 9700 0010. You can send a message only to 0809 955 5577. We're also on WhatsApp. The number is 0708 711 0839. Alright, it's now time to meet my guest on today's edition of NCDC Situation Room. And I'm happy to introduce you to the technical team lead, National Lassa Fever Working Group Nigeria, Mrs. Elsie Ilori. Madam, thank you very much for joining us on Situation Room.
Thank you. I'm really privileged to be here.
Now, Mrs. Ilori, let's talk Lassa fever. Year in, year out, we have seen a lot of lives lost as a result of this disease. And every year, it seems the number is growing. As the technical team lead, what are we doing to ensure adequate prevention of Lassa fever, especially deaths occurring from it?
In fact, I'm really sad too when we have deaths in any disease, and Lassa fever especially. Now for this year, what we have done, we have sensitized, number one, the states, because their main responsibility is this responses at the state level. So early November, we sent letters of alert to the states, telling them to be prepared for the outbreak. Yes, Lassa fever, we see cases all year round, but we have peak season. And so for us to prepare towards this peak season, we have to put so many things in place. When we had the outbreak for 2018, immediately after the outbreak, we trained clinicians, that's doctors, nurses, epidemiologists, surveillance officers, laboratory scientists, health educators, at least 6 persons in each of the states, including states that did not record any confirmed case of Lassa fever. We trained them, preparing them for any case of Lassa fever. So we did that for all the 36 states, including the FCT. Because, like you said, we want to prevent deaths. Yes, we have sensitized the people, but sometimes people still do what we tell them not to do. So if they have the Lassa fever, we should be able to manage them properly and then sensitizing them to report early. Of course, we have also started with the media Because the media is very important to us. They are the ones that carry the message across to the people. And the people tend to believe you when you say this is what is happening. This is how it should be. And so people tend to believe the media.
Well, madam, you said that clinicians, health workers, have been trained in each of the 36 states of the Federation, including the FCT. But if they are adequately trained, considering so many cases involving doctors and nurses, the numbers from the last outbreak in Abakaliki and some other places were very discouraging.
Yes, we had those situations before the training. So the training was after the situation that we had with the deaths of the doctors for Lassa, because they were not properly sensitized. They did not have a high index of suspicion when they saw the case. And so that was why we went out and said, okay, we will not only train the states that reported, we will train all states in the Federation. And we picked 6 key persons in the states that will respond to Lassa fever.
So what did you tell them to do in terms of prevention for Lassa fever?
For each of the persons that were trained, according to their profession, the clinicians were trained on how to manage cases, how to have high index of suspicion when they see a case of fever that has been treated malaria for 3 days and is not responding. You should have a high index of suspicion at that level. And so we trained them how to manage in terms of administration of the drugs and how to do all the other management, the case management. Now, for the laboratory scientists, we trained them on how to collect the sample because it is very key. Well, it's only the laboratory that can tell us that it is Lassa fever. So we collect sample because, it presents as a fever, malaria, but it's only when we do the laboratory test that we know that it is actually Lassa. The health educators are the ones that sensitize the people, and they are very, very key. So we trained them on how to do the risk communication activities, how to sensitize the people, all those we did. And then the surveillance officers are expected to look for detection of the cases. And so the surveillance officers were trained on how to detect the cases. And also, when there is a case, there is something we do for Lassa fever. We call it contact tracing. When you have a confirmed case, all those that had contact with the confirmed case are supposed to be followed up for 21 days. And so that exercise is very key. So the surveillance officer is trained to do that. Of course, the epidemiologist is the one in charge in the state, and he has to know when it occurred, how it occurred, epidemiology. So each state had those components of persons trained.
After this training have been given to them, I want to believe they are being monitored to see how they are applying the training to protect themselves. What would you say about their performance from what you have observed? Would you say that they are up to the task to manage Lassa fever?
And now, sometimes you train people depending on the individual. Commitment is an individual thing. Yes, we have trained them. What we also do at NCDC is that we also provide the necessary supplies for them to manage. We provide the medicines and all the other support items for management of Lassa fever. But then some of the states have really taken it up. They have really taken up after the training. They have really built themselves. I'm really impressed with some states. I don't know if I will mention states, but states like Nasarawa State, the Federal Medical Center in Kefi, they have a committee on Lassa fever. The training was for a person, but they have also gone further to train other people in their facility.
Are you also recommending this to other states?
Of course. Other states, especially those that do not have the Lassa fever, those that have Lassa fever, they are up to it. They have been so trained. They know what to do. We have 3 major treatment centers in this country. We have the FMC Owo. We have the one in Abakaliki, Ebonyi State, Federal Teaching Hospital, Abakaliki. And then we have the one in Edo State. That's the Center for Lassa fever. Irua, yes. And so they already know what to do in terms of management of Lassa fever. Now, for other states that are coming up, we have other treatment centers, maybe not as well established as these 3 major ones that I've talked about, but they are also trying their best to manage cases that they see. And that's why I use FMC Kefi as an example, because they have so built themselves. They've tried as much as possible to manage cases. But fortunately for them, they've not really had any issue for some time now. But what they're doing is preparing. They're in a state of preparedness. So they're training their clinicians, they're training all their nurses and staff on how they will manage Lassa fever.
Okay, madam, you talked about training at the national level and also at the state levels. And from what you're saying now, they're also retraining others. That's cascading to the local government. Now, our concern is majorly the number of deaths involving health workers. So many of them were lost in the last outbreak trying to save lives. We have a case this week of a nurse involved in those confirmed as having the virus in Ondo State. What would you say could be responsible for this, and what advice do you have for the health workers?
Yes, I'll first of all start with the advice. I will advise health workers to be very, very conscious and to have that high index of suspicion. That's what we always preach. You have a patient that comes in with fever that is persistent, you should be able to suspect any other disease apart from malaria, and Lassa fever will happen to be one, viral hemorrhagic fever. And we also advise them to take standard precaution. That is very key. Apart from having a high index of suspicion, you must take your standard precaution. And that's one of the basic training that was given to all health workers, standard precaution. You protect yourself, and that's basic. And what is the minimum protection is to put on your gloves when you want to treat a patient, any patient at all, because anyone that comes in is a potential infection. So you must protect yourself, and that's basic for all health workers. But for the ones that are happening, yes, we've had incidents of health workers coming down. It's unfortunate, and I cannot say this is the reason why it happened. Sometimes we are so passionate as health workers, we want to save lives, and so in the process we tend to forget that we need to protect ourselves, and so we just go all out. Some can be sometimes careless, I would put in quotes. I'm not saying they're careless, but it's just that we're sometimes very passionate about managing patients. So it could be one of the reasons. I can't really say.
Now, let's talk about key activities in your department. I know we have had some cases this year. How well are we doing with the case management?
Yes, for case management, we've recently had a training in Lagos. It's called the Best Clinical Practice. We invited the case management physicians from treatment centers, not only the major treatment centers, the 3 major treatment centers, but from all other treatment centers. We've trained them on how to manage Lassa fever cases, what's the best practice, what's the best way to manage Lassa fever case. We just did that recently. The other part is, it's not only case management, we need to also sensitize the people. And so that's part of what we're doing. This situation room is part of what we're doing, sensitizing the people, telling them that this is what you should do. This is what Lassa fever is all about. We do not need to be scared of Lassa fever. If we have it, what are the next steps to do? Visit the next facility. Do not self-medicate. That's one of the things. And then also we have been very proactive this year. Not that we were really taken unawares. We were not really taken unawares because we were expecting to have the outbreak, but the report of death in a health worker took us unawares. Because last year we went out to do some sensitization, even in the states where we recorded the death in health worker. But this year we've been more proactive. We have done the media sensitization not too long ago, trying to sensitize the media. Like I said earlier, the media is a source of information to so many people. And whatever the media says, people believe. And so we have sensitized the media to tell them how to pass the message, the right message across to the people. Because sometimes when you do not have information, the tendency to give the wrong information is there. We also have newspaper publication running through the week. We have engaged the civil society organization because they are closer to the people. And then recently also we held a preparedness meeting with the states. Like I mentioned earlier, Lassa fever is a state response, and it is the responsibility of the state. NCDC's function is to support the state. So what we did just some few days ago is to call the directors for public health in the state to sensitize them and educate them on what they are expected to do at the state level. So we called the Director of Public Health and the Health Educator. Like I said earlier, the Health Educator is very, very key because they are the ones that go out to the public. They are the ones that sensitize the community. They are the ones that go out and do the community engagement. So we brought them to Abuja and trained them on what we expect them to do.
We do hope for best outcome from all you've been doing to protect the nation against Lassa fever and other diseases. We want to say a very big thank you to you, Technical Team Lead, National Lassa Fever Working Group, Nigeria, Mrs. Elsie Ilori, for coming on Situation Room.
Thank you. It's a pleasure to be here.
What is this Lassa fever I hear about?
It's an infection caused by Lassa fever virus. It occurs through direct contact or contamination with urine, feces, saliva, or blood of infected rats or persons. It can affect people of all age groups.
And how do I know someone that has Lassa fever?
Symptoms appear 2 to 21 days after contact with the urine, feces, saliva, or blood of infected rats or persons, or all may start with a fever, tiredness, body aches and pain, sore throat, vomiting and diarrhea, cough, restlessness, swelling of the face, bleeding through the nose, ears, eyes, mouth, and other body openings occur later.
How can Lassa fever be treated?
Avoid contact with rats, dead or alive. Keep the home and surrounding clean. Store water and food items in rat-proof and covered containers. Don't spread food items along roadsides and open spaces. Take utmost care when around people suspected or confirmed to have Lassa fever. Patients who die from Lassa fever must have safe burial. This prevents transmission of Lassa fever.
Can it be treated?
Yes! Seeking treatment early is key to successful treatment. Immediately go to the nearest health facility if you experience any of these symptoms.
This message is brought to you by the Federal Ministry of Health, the Nigeria Center for Disease Control, World Bank Redice Project, and UNICEF.
And that's the size of the program NCDC Situation Room for today. Remember all that we have told you in the program. Prevention of Lassa fever relies on promoting good community hygiene. Do not allow rodents into your homes. Avoid exposing your foodstuff and water. Prevention, they say, is better than cure. If you want more explanation on what you have heard or you just want to know about the Center for Disease Control, reach us via Twitter. The handle is at NCDCGov. On Facebook, it's Nigeria CDC. You can also reach us through a toll-free line. That's to say you do not pay when you call 0800 9700 0010. Send messages only to 0809 955 5577. You can also find us on WhatsApp. The number is 0708 711 0839. Thank you very much. The program is a production of Gado Agency Limited under the sponsorship of the Nigeria Center for Disease Control, NCDC. Visit their website to know more about the center. It's www.ncdc.gov.